Well, plastic surgeons are seeing a sudden bump in their business, and it doesn't have anything to do with finding the right price.
In fact, in many cases, the patients are not the ones paying for their procedures. Dr. Frank McGeorge is here to explain who's getting the surgery and why.
The patients are recent graduates of high school and college, and the people paying are their parents. It seems more students aren't dreaming of a big trip or a new car. They want to start their next chapter with a new nose, bigger breasts, or both. Graduation. It's a time for fresh starts, bright futures, and plastic surgery.
Typically every spring there's an increase in the amount of calls for people who are wanting plastic surgery as graduation gifts.
Troy plastic surgeon Dr. Anthony Youn says it's not unusual to schedule procedures before a major life change.
College students who have surgery before they go off to their jobs, and even people who are in transition points in their lives after a divorce or before a wedding, that people have it done.
But the prospective patients are getting much younger.
I'm actually shocked by the amount of teenagers that are having plastic surgery done and breast augmentations for high school graduations, and that's something that I think is a very troubling trend.
According to the American Society of Plastic Surgeons, the number of breast augmentations among women age 18 to 19 rose about 12% between 2005 and 2006. Nose jobs, skin resurfacing, and liposuction also make the wish lists of many grads. But Youn cautions, no surgery should be taken lightly.
Breast augmentation, liposuction, these have real complications. They're serious surgeries, and for somebody to decide to have it done, they need to be mature enough to really understand why they're doing it and what are the ramifications of it.
Youn believes reality TV shows depicting young people getting plastic surgery are driving the trend.
It's glamorizing our profession, it's glamorizing surgery, which is a very serious thing.
Youn says he won't perform purely cosmetic procedures on anyone under 18, but there is one procedure he believes can be appropriate: breast reduction surgery.
These young girls who develop breasts that are so large that they have back, neck, shoulder pain, they have grooves in their shoulders, and they can't exercise. I have no problem doing a breast reduction surgery on somebody like this because it really is a new lease on life for them.
Melissa Mato agrees. The 22-year-old from Plymouth just graduated from college and had breast reduction surgery.
I've been thinking about having it since I was 16.
Melissa says she didn't have the courage or confidence to get the surgery before, but now the time was right. Her back and neck pain are gone, and she's looking forward to shopping for a wedding dress for her wedding next year.
I'm glad I didn't do it as a high schooler, but I'm also glad I didn't wait any longer. It was kind of now or never. I knew if I didn't do it now, life was going to happen to me, and I was going to get into a career, and I would never take time out to do it for myself.
Youn urges everyone to give surgery the same careful consideration, but says he understands the desire for a fresh start. He had plastic surgery as a teen himself to correct a deformed jaw.
I think I understand as much as anybody what it's like to feel different, to feel unusual. I had a jaw that was twice the size of Jay Leno's, and between my high school and college years, I had it broken in 2 places and set back.
Youn says the surgery was ultimately the right choice for him, but reminds his young patients there is no reason to rush.
To those people who feel as if, I need something done now and I'm young, but if I don't have it done now, how's my life going to be? Really, there's time for you, and things change.
Youn shares a humorous take on his own experience with surgery, as well as what drove him to become a plastic surgeon himself, in his new book called In Stitches. Now, it is available at bookstores and on Amazon.com. Now, as for the idea of parents offering to pay for these procedures as a gift, Youn says they never want to see someone being coerced into surgery or who might feel obligated because it was a gift. If everyone decides that it's a good idea and the timing is right, then that's one thing. But making it a gift should not factor into that equation. Back to you.
All right.